Hello everyone, I'm Vineesha. I'm a certified IBS dietitian and I'm also certified in SIBO and IBD nutrition management. Today in this video, I want you guys to understand what exactly is irritable bowel syndrome and how SIBO contributes to irritable bowel syndrome in 70% of cases. So, when you have symptoms of bloating, gasiness, food intolerances, and your digestive issues keep altering depending on the food you take, and also you see a significant change in your bowel pattern, that is, you might feel constipated, you have mixed bowel movements like both constipation, diarrhea, incomplete, the feeling of incomplete evacuation, or you might have diarrhea type of stools. If these collective symptoms are being experienced by a particular individual for more than 4 months, then it is categorized as irritable bowel syndrome. But before we jump on to the conclusion and diagnose the irritable bowel syndrome, just based on the symptoms, it's very important to get the right evaluation done by your doctor. The reason behind this is the primary evaluation is always important because in IBS, the symptoms of gas, bloating, nausea, otherwise you have food intolerances, food sensitivities, changes in the bowel movement could actually overlap with the symptoms of other organic diseases. So here there are a vast chances of missing the actual diagnosis if you are not getting it evaluated properly because symptoms of endometriosis, otherwise pelvic floor inflammations, intestinal cystitis, otherwise IBD and celiac disorders could also overlap with the symptoms of IBS. So, getting a primary evaluation and a proper diagnosis is the first step to understand what exactly your gut is trying to communicate. So, once the diagnosis of IBS is established, here we should dig deep into the root cause of IBS. In 70% of the cases, it's a small intestinal bacterial overgrowth which is making them IBS unresolved. So, what is exactly this SIBO stands for? So, the natural phenomena is in your large intestine, you might have a wide range of microbiome which could help you with the digestion and absorption and excretion process, which is quite normal. These are actually called as pathobionts. They are not the pathogens. But whenever these microorganisms that stays in the small large intestine start traveling back into the small intestine and they start colonizing there, that's where the diagnosis of the SIBO begins. SIBO is exactly the unwanted microbiomes being colonized in the small intestine, giving you the symptoms of bloating, indigestion, flatulence, burping, and feeling of heaviness after meal, loss of appetite, nutrient malabsorptions like whenever you get the blood work done, you're always low on iron and B12 specifically. You have a lot of food sensitivities and food intolerances and your bowels keep changing. Either you are extremely constipated, you have signs of diarrhea or mixed bowel movements. So these are the symptoms of SIBO. Now, whenever there is an colonizing of bacteria in the small intestine, usually they start impacting the nutrient absorptions because they decreases the brush border enzyme production. Hence, you go low on the digestive enzymes. Otherwise, they impact the because of this microbial colonization. Sometimes it could be the candida overgrowth in the small intestine also, which can lead to the disturbances in the microvilli size and structure. Hence, the malabsorption continues and you start losing the weight. No matter what you eat, it always makes you feel bloated. So, depending on the types of the SIBO, there are three types. Number one is the bacteria or microorganisms that are colonized in your small intestine can actually produce three type of gases. Number one is hydrogen, number two is methane, number three is hydrogen sulfide. When you have hydrogen overgrowth, you see mushy stools and with a combination of constipation. So it's generally a mixed type of stools, which what you see in hydrogen overgrowth. When you have methane overgrowth, it's mostly constipated stools, and this methane overgrowth is commonly seen in people above 50 years. As you age, the methane overproduction happens naturally. And second case is if you are a woman around 45 to 50 and you have attained early perimenopause or menopause, and you're suffering with constipation, possibly it could also lead to the methane overgrowth because of the disturbances in the hormone called as estrogen. Number three, hydrogen sulfide. When you have diarrhea type of stools, mostly the presence of hydrogen sulfide indicate diarrhea type of stools. Hence, these three types, depending on the type of bacteria or type of infection that's going on in the small intestine, you might see the symptoms. Common symptoms are bloating and food intolerances, a lot of abdomen pain or feeling gasiness, flatulence. No matter what type of microbiome colonizes in your small intestine, you see these five symptoms. Retrograde motility also, you see these 5 6 symptoms commonly, but the stool types varies between types of the SIBO. So depending on the your stool type, we can also assume the presence of what type of SIBO you are suffering with. Apart from assuming the symptoms, apart from correlating the symptoms and then concluding the diagnosis, there is a test called as SIBO breath test, which might help you to understand what type of SIBO you usually have. If you are staying in India, the probability of getting SIBO breath test available, easily available in certain areas could be a little difficult, but there are certain hospitals which are providing SIBO breath test for hydrogen and methane commonly. Getting a breath test done for hydrogen sulfide in India is still not available, but we there are certain institutes abroad which has this trio kit, which means that they test both all the three gases for hydrogen, methane, and hydrogen sulfide overgrowth. Um in India, if you're getting it done, you are most likely to test for the glucose and understand if you are having either hydrogen overgrowth or methane overgrowth. In SIBO breath test, the evaluation goes depending upon the fluid which you are ingesting, either glucose or lactose. According to my understanding, if you want to understand the diagnosis of SIBO, it's better to get both glucose tolerance test and the lactose tolerance test for the SIBO rather than depending just on the glucose tolerance test, because sometimes the lactulose solution actually gives a better interpretation of the SIBO when compared to the glucose solution. So I would recommend, if it is affordable, get tested for SIBO breath test, both hydrogen and methane, with a combination of glucose and lactulose solutions. So depending on the interpretations, you can get to know whether you have SIBO or not. But before giving to the SIBO breath test samples, there are certain dietary recommendations I would highly suggest. Number one is, don't be on extreme elimination diets before giving the SIBO breath test. Number two, if you have recently got your colonoscopy done, wait at least for a month before giving your SIBO breath test. Number three, if you're there on antacids, antibiotics, or laxatives, ideally you should be stopping all these supplements at least for 1 week before giving the SIBO breath test. Number four, if you are on any motility enhancers or if you are on any natural herbal antimicrobials, be Ayurveda or naturopath, I would highly recommend to stop all these supplements and the medications at least for a week before giving the SIBO breath test. There are many chances of getting into the false negatives or false positives depending on the precautions or pre-precautions you take for the SIBO. You are more likely to show up SIBO positive if you have false positive if you also have an H. pylori infections. So H. pylori infections are one of those factors which can contribute to the false positive report of a SIBO hydrogen breath test especially. So make sure that whoever that is testing for you takes a very clear dietary assessment and a very clear supplement assessment before you start giving your breath samples for the SIBO breath test. At our clinic, we can provide SIBO breath test, which tests for both glucose and lactose solutions, and we test for hydrogen and methane. If you are interested, you can follow me on Instagram, and I'll be updating you guys about how to get the SIBO breath kits from our clinic. So now, since we spoke about the types of SIBO, let us today understand the most common type of SIBO, which is methane overgrowth, contributing to the constipation. If you're someone who's been suffering with a very chronic constipation issues, you have done everything and tried every possible laxative, over the counter laxative for years together, I want you guys to understand this simple three-phase protocol in order to resolve your SIBO. I'm not going to promise that this protocol is effective in all the cases, but whatever I can put forth for you to make this SIBO protocol easy, I'll try to establish in a simple three-phase protocols. So first thing first, in methane overgrowths, the stubborn thing is they will not allow the peristalsis to happen. So you might feel the urge to evacuate or you might not feel the urge to evacuate. So whenever we are trying about the SIBO, we are talking about a combination of infection and not having peristalsis. So now what is the first step to target is you have to target your infection through an antimicrobial, and you have to target to improve the peristalsis through a prokinetic kind of thing. So for targeting the bacterial overgrowths, I highly recommend oregano oil as a supplement protocol. I would leave few recommendations in the descriptions. You can check out the description for the product recommendation. So once we are using a combination of antimicrobials, now we should get into the appropriate right doses of prokinetic or a laxative, which is going to help you to keep the motility of your intestines intact. For me, the favorite recommendation would always goes magnesium citrate. I told several times in my Instagram about magnesium citrate. You can start magnesium citrate anywhere between 500 to 1000 mg depending on the severity of the constipation. So the first phase, what you have to do, figure out the use of this one antimicrobial with a combination of magnesium citrate, and you need a digestive enzyme if you are positive for SIBO. Because as said previously, SIBO could interrupt the brush border enzymes, reduce the digestive enzyme productions. It can lead to a lot of food intolerances, which can push your GI system into a leaky gut condition. In order to prevent all these things from happening, I would suggest you guys to start off any digestive enzyme. So phase 1 should be a combination of ideally digestive enzyme, magnesium citrate, which is a prokinetic kind of thing, or ibirogast if you are saying if you have access to buy ibirogast, I would highly suggest ibirogast along with the combination of magnesium citrate and oregano oil. Do this for 1 month or 45 days with a combination of low FODMAP diet. In case if you're confused about the low FODMAP diet, I highly recommend to work with a functional nutritionist or sign up with us guys, because it people who don't know the alternative recipes for a high FODMAP, when they initially start the low FODMAP diet, they quickly drop weight. I don't want anyone who are already underweight to try all these phases on your own. It's ideal thing to sign up with us or any other functional nutritionist who is specialized in SIBO or IBS to guide you properly and not to lose weight when you have this underlying SIBO as a root cause for your IBS. And if you think the low FODMAP is helping, but still if you are losing weight, I highly recommend working with us. So the first phase is to target the bacterial overgrowths, keep your gut motility intact. And number 3 is like find the right digestive enzymes. I may not able to suggest digestive enzymes as a common one, but still I'll put a link in the description for your feasibility. But I would highly recommend talk to your practitioners before jumping onto the digestive enzymes, because when you take digestive enzymes, that comes with a combination of beta and HCl, and if you already have inflammation of the stomach, say like you're treating for acid reflux, you're on antacids, the potency of digestive enzymes might aggravate your inflammation of the stomach when you have stomach underlying conditions like gastritis or erosive gastritis or H. pylori. So there are certain do's and don'ts whenever you start taking digestive enzymes. So highly recommendable thing is like start working out with a nutritionist, functional nutritionist if you have multiple issues. So this is about the phase 1. In phase 1, if your gut is getting better, say like your motility has improved with the magnesium citrate or any other prokinetics like ibirogast or ginger supplements, and digestive enzymes are helping, you're feeling better at least like 30 to 40% of the time. So in phase 2, what we have to understand is when you get a blood work done, generally in SIBO cases we see the deficiencies of B12, vitamin D's and iron deficiencies. So, phase 2 is all about supplementing the nutrients that are required for a better cellular functionality, so that if you're feeling lethargic or lack of energy or reactive hypoglycemia, you would start feeling better. So, in phase 2, I highly recommend to start your B12 supplements, D3 supplements, and other like NAC or glutathione, any antioxidant supplement to enhance the healing process for the better functionality of your overall GI tract. And also in phase 2, we can understand if you have leaky gut symptoms, say like skin issues or allergy issues, a lot of food sensitivities, which is telling that there is an underlying cause of leaky gut. So the supplements to strengthen the leaky gut can also be started in the phase 2. And now, if your symptoms are better with the low food map, continue it for 2 more weeks in the phase 2. Otherwise, you can start the reintroduction phase in phase 2 itself. What we usually do in our practice is it varies from client to client. Definitely, it's not same principle for everyone. So depending on the progress of the client, we either start with the reintroduction or we tend to continue the low food maps or customized food maps in the phase 2. So, second phase is all about getting your body the enough nutrient support in order to support, enhance the process of healing and getting better with the SIBO. So, in phase 3, if everything goes well in phase 2 and phase 3, then only you enter into the phase 3. So phase 3 is all about reintroducing. While you continue your magnesium citrates and prokinetics and antimicrobials digestive enzymes, this is the right time for you to reintroduce the high FODMAPs back into the diet. So, when you're reintroducing high FODMAPs back into the diet, if you are seeing slowly the changes are getting better, the symptoms are getting better, then it's an indication that your GI system and the small intestinal bacterial overgrowth is reducing. Hence, you are able to tolerate the high FODMAPs. But by any given chance, if the high FODMAP reintroduction is failing, the moment you include pulses and legumes or high FODMAP vegetables, high FODMAP fruits, if your symptoms are coming back, it's a high time that you start working with a functional nutritionist, or you can come back and sign up for us. To be precise, SIBO needs a healing period anywhere between 3 to 6 months, and this can get a little overwhelming when you're trying to do everything by yourself. But people who have mild constipation issues can always try this combination of a prokinetic, magnesium citrate, digestive enzyme, and what else? Digestive enzymes and other microvitamins which your body require. This should actually show you an improvement. But if this improvement is not according to what you are looking for, it's good idea to sign up with us or any other functional nutritionist. For any supplement recommendation, kindly drop a message or leave a comment. I would definitely get back to the comments.